For any sport that requires use of your hands, which is most of them, right, you're going to tend to have some irritation if you play a lot of either your forearms on this side or that side. So on this side, you've got golfer's elbow, and this side you get tennis elbow. And by the way, people that play tennis get golfer's elbow, and golfers get tennis elbow. And that doesn't really, the name doesn't really correlate that much. So there's no harm in doing some self-maintenance on it. You're not going to damage anything. 99% of the time, the pain here and here is just musculotendinous, so where the tendon and muscle come together. So you could use a hypervolt gun, any kind of massage gun. You could do self-massage. You could basically do anything you want to sort of desensitize the area. My personal preference is using these things here. So I like to scrape the area first. All this stuff is purchasable on Amazon, but you could also just use the back of a butter knife. Anything really. The Chinese came with this. This is called gua sha, and they used to use rocks, stones, shells, and anything to create a little bit of friction. So grab something like this, get a little lubricant on there, find the tender spot, okay, and you want to scrape it first. And you're just trying to get the area a little bit pink. All right, now you want to come at about a 45-degree angle, pick up like that, and then you start doing it kind of fast. And just till you get just a little bit of color there. So usually about a minute is about all it takes. And it's already starting to get a little bit red. Then take some of that lubricant, okay, and just do some self-massage. Now usually the pain's gonna be right where the tendon starts to attach to the bone. So usually up in this area. But you do wanna kind of comb through the whole muscle because it's this muscle, it's really a group of muscles that get irritated from overuse. The same thing here. It's the pain's usually going to be here, but comb through the entire muscle, see where you have some tender spots. So spend a couple minutes doing that. If you find something that's real tender, and notice that I'm going nice and slow. Don't just do this, right? That doesn't do a whole lot. Muscles respond to sort of deep, constant pressure. So find a spot, and maybe I have something right about there, okay? And then put some good sustained pressure on there. So if you have something that feels like a trigger point, you can do a hold right there. After a few minutes doing that and desensitizing the area, use a cup. Like 20 bucks on Amazon for a set of cups like this. All right, and you just go right through the muscle, okay? You can kind of go back and forth. All right, I wouldn't just leave it there. That tends to leave a bruise. I try to not leave bruises. I'd go back and forth, and you can play with some movement with this as well. All right, do that for a few minutes as well. People always ask, how long should I do it for? Do it as long as you're making a change or has stopped making a change. So, the whole thing, maybe 3-4 minutes total, right? After that, I always try to follow up with, okay, so you've desensitized the area, now you want some blood flow back to the area. And part of this getting a little pink is some blood flow, but then you want to actually use the muscle. So this side does wrist flexion, and this side does wrist extension. And by the way, most of the time when there's any kind of tennis or golfer's elbow, there's usually a limitation in the neighboring joint. So for example, if you're missing external rotation of the shoulder, when you go to swing, say I was a left-handed golfer, as I come back this way, you tend to hyperextend the wrist, and that will overuse that side. So usually neighboring joints, there's a limitation, and it's ending up in the elbow. That's a side note. Anyways, so I've desensitized the area, and then I want to use it. So you can use something like this. Oh, good, you go this way actually, right? So like this, you could do like wrist curls like that, nice and slow, high repetition, something easy that you could do 30 or 40 reps with. And the whole idea here is to get some blood flow back to the area. Using just a hand weight is fine. If you were doing this side, it'd be going this way, or kind of doing something like this. All right, again, high repetition, and stay pain-free.